Hey, Nigel.
Hey, Nick.
You know, there's an urban legend around the purchasing department that I heard. I wanted to verify that with you. Is it true that one time you ordered a penis pump into Starfish?
The one for work? Yeah, it's true. I did actually once order one. And you know, I was looking for a variety of different types of suction cups for your skin.
Right.
And I found a number of great ones as far as cupping, you know, like that kind of ancient, I think, Chinese medicine.
Sure, yeah.
But they were all too big, and so I needed one that was a little smaller, and I found one, I thought, I don't really want to order this at work, but then I thought it's exactly what I need, and I'm not going to let a little bit of stigma get in the way of what I need for the client.
Good for
and
you.
I thought,
don't let stigma stop innovation.
That's right. And I thought, you know, maybe I'll get laughed at for a couple of days.
Sure.
Not 10 years later.
Sorry.
So anyway, here we are, just kind of riding that train. But it's interesting. The reason we were doing it was because suction can actually has actually been shown to reduce pain associated with injections.
Amazing.
If you were to suck right at the site of the injection.
Okay, sort of like I guess there's some truth to that, right? Because you think about the ancient technology there being used for the
and you know that those aren't necessarily supposed to do with injections, but you know, same idea as far as kind of affecting the way your body feels pain and how your muscles work. And it's interesting because you know, if you actually watch some you know, nurses or people who are giving injections now, you might actually find that they pinch the skin around the injection, and you know, so what you're doing is you're creating a bit more flesh as opposed to bone, and you are also maybe adding some of that reduced pain factor. This is where we kind of get into like the nuanced like differences between people, and you don't always know the facts, but that's something that people do.
Oh, fascinating.
Yeah. So anyway, so it's quite interesting, simple technology, and you kind of see it in a variety of ways. You know, we were just talking about microneedles. There's products out there that kind of combine suction and microneedles. Yeah. The other cool parts, of course, are that you know you can pull the skin up right to a certain level, which is nice because you can control injection depth quite deeply, quite accurately.
Yeah, right.
And then you know, you tell me what happens when you expand tissue that you're trying to inject liquid into.
Oh yeah,
Little
right.
physics
You're gonna change the dynamics, the interface, and the interstitial fluids.
And you're creating space, right? Exactly.
Fantastic.
So that's right. So your interstitial fluids, you know, are filling up all the space. But if you kind of reduce pressure, you're going to allow some more space for your kind of biologic to get in there, and that helps, you know, make sure it stays in the right place and absorption and things like that. So it's quite interesting, and again, kind of simple technology that's got a lot of promise, I hope, for the future, and I thought I would just talk about that today.
Yeah, well, in that case, hopefully the product did suck.
That's what we shoot for here.